Climate change is one of the most significant global challenges of the 21st century. While much of the discussion around climate change focuses on rising temperatures, extreme weather events, and environmental impacts, the human health consequences are just as severe. Changes in climate can directly and indirectly affect human health, exacerbating existing health issues and creating new ones. So in this video, we are discussing the climate change and its effect on human health. So before we start, please like this video and subscribe to our channel for future updates. The World Health Organization estimates that between 2030 and 2050, climate change will cause an additional 250,000 deaths per year due to malnutrition, malaria, diarrhea, and heat stress alone. These health risks will disproportionately affect vulnerable populations, including children, the elderly, and those in low-income countries. Heat-related illnesses. As global temperatures rise, heat-related illnesses are becoming increasingly common. Extreme heat can lead to heat exhaustion, heat stroke, dehydration, and exacerbate cardiovascular and respiratory conditions. In urban areas, the urban heat island effect, where cities are significantly warmer than surrounding rural areas due to human activity and infrastructure, further intensifies the risks. According to the Centers for Disease Control and Prevention, CDC, between 1999 and 2010, the United States saw more than 7,000 heat-related deaths, with climate change expected to worsen this trend. The rise in temperature also increases the frequency and intensity of wildfires, which further endanger health through smoke inhalation and respiratory problems. Vector-borne diseases. Climate change is influencing the spread of vector-borne diseases, which are diseases transmitted by vectors like mosquitoes and ticks. Warmer temperatures and altered rainfall patterns have expanded the habitats of vectors, such as the Aedes mosquito, which spreads diseases like dengue fever, Zika virus, and chikungunya. The CDC reports that between 2004 and 2018, the number of reported cases of mosquito-borne diseases in the U.S. more than doubled, with climate change playing a central role. Furthermore, rising temperatures enable disease vectors to move into new areas, including regions that were previously too cold for these organisms to thrive, increasing the risk of outbreaks in previously unaffected regions. Air quality and respiratory health. Climate change also has a direct effect on air quality, which in turn affects respiratory health. As temperatures rise, the formation of ground-level ozone, a key component of smog, intensifies, exacerbating conditions like asthma, bronchitis, and other respiratory diseases. The American Lung Association reports that more than 25 million Americans suffer from asthma, and climate change is likely to increase these numbers. Furthermore, wildfires, which are becoming more frequent and severe due to changing climate conditions, release large amounts of particulate matter into the air. Exposure to wildfire smoke has been linked to a range of respiratory problems, cardiovascular diseases, and premature death. Nutrition and food security. Climate change is also affecting food security, which has significant implications for human health. Extreme weather events, such as droughts, floods, and heat waves, can damage crops, disrupt food production, and lead to food shortages. The Intergovernmental Panel on Climate Change warns that climate change could reduce global crop yields by up to 20% by 2050, significantly impacting nutrition. This, in turn, increases the risk of malnutrition and foodborne illnesses. For instance, higher temperatures and fluctuating rainfall patterns can increase the prevalence of diseases like Salmonella and E. coli, which are transmitted through contaminated food and water. In developing nations, these disruptions are more pronounced, leading to higher rates of undernutrition and related diseases. Water scarcity and waterborne diseases. Water scarcity, exacerbated by climate change, is another major factor affecting human health. As climate change alters precipitation patterns, some areas are experiencing more frequent and severe droughts, while others are subject to intense flooding. Both scenarios lead to water insecurity, which can hinder access to clean water and sanitation. In turn, this increases the risk of waterborne diseases such as cholera, dysentery, and giardia. The WHO estimates that by 2025, nearly half of the global population could face water stress. Moreover, flooding can also lead to contamination of drinking water supplies with pollutants, further contributing to the spread of waterborne diseases. Mental health impacts of climate change. The effects of climate change on mental health are becoming more evident. Extreme weather events like hurricanes, floods, and wildfires often lead to displacement, loss of livelihoods, and trauma, all of which can contribute to mental health disorders such as anxiety, depression, and post-traumatic stress disorder, PTSD. Additionally, the uncertainty about the future and the feeling of helplessness in the face of climate disasters can lead to eco-anxiety, a growing psychological issue. A study by the American Psychological Association found that more than 60% of adults in the U.S. report being concerned about climate change, with many feeling anxious about its potential impacts on their health, families, and communities. Vulnerable populations and climate inequality. Climate change disproportionately affects vulnerable populations, including the elderly, children, and low-income communities. These groups are often more susceptible to the health impacts of climate change due to limited access to healthcare, poor housing, and inadequate resources for adapting to changing conditions. For example, older adults are more likely to suffer from heat-related illnesses, while children are at greater risk of respiratory diseases due to air pollution. Additionally, marginalized communities, especially in developing countries, face higher risks from food insecurity, water scarcity, and the spread of infectious diseases, making climate change a critical issue of social and health inequality. The economic costs of climate change on health. The economic burden of climate change on healthcare systems is escalating. As climate-related health issues become more prevalent, the costs of treating diseases, managing disasters, and addressing mental health impacts increase significantly. According to the Global Commission on Adaptation, the economic toll of climate change could reach hundreds of billions of dollars annually by 2030, putting immense strain on both healthcare infrastructure and national economies. The role of governments and healthcare systems in addressing climate change. To mitigate the health impacts of climate change, governments and healthcare systems need to take proactive measures. This includes implementing policies to reduce greenhouse gas emissions, such as transitioning to renewable energy sources, improving public transportation, and promoting sustainable agriculture. Health systems must also be equipped to handle the rising burden of climate-related health issues by investing in climate-resilient infrastructure, enhancing disaster preparedness, and ensuring that healthcare is accessible to vulnerable populations. The integration of climate change considerations into public health planning is essential to protect the health of future generations. Adaptation strategies and health resilience. Adaptation strategies play a crucial role in minimizing the health impacts of climate change. This includes developing early warning systems for extreme heat events and natural disasters, which can help vulnerable populations take protective measures. Urban planning must prioritize climate resilience, such as creating green spaces to combat heat and reduce air pollution. Additionally, improving the availability of clean water, promoting climate-resilient agriculture, and strengthening healthcare systems to address climate-related health problems are essential steps toward building resilience. Public health campaigns that raise awareness about the effects of climate change on health and encourage sustainable behavior are also important in reducing future health risks. Global cooperation and action. The global nature of climate change means that addressing its health impacts requires international cooperation. The Paris Agreement, adopted by nearly 200 countries, aims to limit global warming to well below 2 degrees Celsius above pre-industrial levels, with a focus on reducing greenhouse gas emissions. By achieving these targets, the global community can mitigate many of the health risks associated with climate change. In addition, countries must work together to share knowledge, resources, and technology to build health resilience in regions most affected by climate change. The collaboration between governments, the healthcare sector, and civil society is critical for ensuring a healthy future in the face of climate challenges. So this is our today's video. If you like our video, don't forget to subscribe to our channel or hit the bell icon. We will meet again with another interesting topic. Till then, stay safe and stay happy.